Well, welcome everybody. So nice of you to join us. Just wait another minute for a few people to get into the Zoom room here. Welcome. Thanks for coming. I'm John Kelly. Okay. All right, we'll get going. Delighted to have you join us this afternoon. Thank you for coming. We've got a fabulous lineup of presenters in our Recovery Science webinar series hosted by the Recovery Research Institute. I'm Dr. John Kelly, and I'm here together with my co-host Maya Matlack, who helps me run the series, and also Chris Rattan, who's our communications coordinator. And as you may know, this is a series that is sponsored through SAMHSA and the Opioid Response Network. And I'll just play you this brief video, which gives a nice little 2-minute overview of the Opioid Response Network, so you can get a feel for what it is and what it does, and before we get started. So here's the little video.
Is there supposed to be sound?
Dr. Kelly, I don't know if your sound is working on your video.
Say that again, sorry. I've stopped the video.
I don't know if the sound is working on your video.
You can't hear any sound?
I cannot on my side. Can other people hear it?
No, we can't.
Nope.
Oh, you can't hear any sound. Okay, well, don't know why that would be. I have to do something with the sound setting here, like original sound off to play a video, original sound on maybe. Do you know, Chris? Is Chris here?
Your screen, there should be would allow you to, like, a toggle for sharing your sound through Zoom.
Okay.
The bottom left, when you hit share screen, where it says share sound, you should click that so that the check mark is on.
Bottom left under video, stop video, or mute.
So if you hit the green share screen and it has you pick the
Oh, share sound, got it.
Yep.
Okay, sorry about that.
Communities across the nation are mobilizing to address opioid and stimulant use and the overdose crisis. You can't overcome this alone, but we can, together, and we are. We are the Opioid Response Network, a coalition of 40 national organizations representing more than 2 million people. We serve all 50 states and 9 territories locally through our network of nearly 1,000 professionals working across prevention, treatment, and recovery. For state agencies, organizations big and small, and individuals working to address local needs, we bring training and education to bear on your efforts. We're here to help you help others through evidence-based support, all at no cost to you. For instance, the Opioid Response Network helped the Tribal College in New Mexico join forces with local organizations to develop a culturally appropriate prevention, treatment, and recovery training series for its students. In Rhode Island, we convened correction staff from 34 states to share how our program had reduced post-incarceration overdose deaths by more than 60% and supported them in their efforts to build similar programs in their home states. In West Virginia, we mobilized to help a clinic incorporate substance use disorder services into their practice, serving a faith-based community. We helped healthcare providers in South Dakota address barriers they face providing treatment services for their patients. We're here to help those on the front lines. So, what are your needs and how can we help? Visit the opioidresponsenetwork.org to learn more and to submit a request for support. The Opioid Response Network, funded by the Substance Abuse and Mental Health Services Administration. Community.
There we go. Hope you all enjoyed that, and that puts you in the picture. Just so you know, again, you can sign up for any technical assistance that you may want for your particular service or practice through the Opioid Response Network. You can put in a request for technical assistance or training. It's free, it's sponsored, federal tax dollars are paying for this, so feel free to reach out and get technical assistance when you need it.
These across.
So, do we have a poll that we're going to do, Maya?
Yes, we have a quick poll for the audience that I will go ahead and launch now.
Okay.
There are 4 questions in this poll, just getting a gist of who's in the audience today, and then a question about your familiarization with the topic. So just make sure you scroll all the way down.
Great, thank you. So I'll just give you a few seconds to finish that brief poll.
Yep, we're at about 80% participation, so I can go ahead and stop the poll and share the results.
Fantastic. Great. Okay. So it looks like the modal response in terms of our topic today, which is recovery community organizations, kind of somewhat familiar was the modal response. This is why I'm very happy and delighted that we've got such great experts in this area to share with us today. Phil Rutherford and Patty McCarthy, friends, longtime friends of our Recovery Research Institute and collaborators. Phil and Patty, thanks so much for joining us. Just a little brief introduction in terms of their many accomplishments. Patty McCarthy has been the Chief Executive Officer of Faces and Voices of Recovery since 2015. Prior to joining Faces and Voices, she was a Senior Associate with the Center for Social Innovation, the C4, where she served as a Deputy Director of SAMHSA's Brass Tax Initiative. She's also served for a decade prior to that as the Director of Friends of Recovery Vermont, a statewide recovery community organization, as well as doing wearing multiple hats in public policy and education throughout her career. And Phil Rutherford is the Chief Operating Officer at Faces and Voices of Recovery. He's a recovery coach, a passionate member of the recovery community. Phil is credited with a significant role in conception, design, and launch and facilitation of the Recovery Data Platform, which some of you may be familiar with. It's a cloud-based platform. It's the first of its kind, and has quickly become a valuable asset in longitudinal data collection for peer-based recovery services. And Phil has been a standing member on multiple federal committees nationally, and we're delighted to have both Patty and Phil with us today to share about recovery community organization. So, Patty, I think you're going to go first, right? I'll stop sharing, and then you want to share your screen.
Yes. Well, thank you very much. It's a pleasure to be here, as always, Dr. Kelly, and thank you for the Recovery Research Institute team and the Opioid Response Network for having us here. We're thrilled to be presenting on this topic and with my colleague, Phil. So Phil, want to say hello?
Hi, everyone, and thanks for having us.
Great. Well, we're going to jump right into it, and it's great to see the survey results that say you're somewhat familiar with recovery community organizations, and our goal is that you will come away being very familiar. And I'm sure that there's a lot to learn, so we'll jump right into our presentation here today. So just a quick overview of about Faces and Voices of Recovery. If you're familiar with us, that's great, but we've been around since 2001. We were launched as a national advocacy and education organization based in Washington, D.C. And we're working hard to change the way addiction and recovery are understood. And we do that through advocacy, education, and leadership. You can find out more about us on the Faces and Voices of Recovery website. So just real quick, we have several programs and services that we operate. These are all more information, of course, is available about our association. It's a national association of recovery community organizations. And we also have an accreditation program for peer recovery support services. We operate the National Recovery Institute, providing training and technical assistance, and a recovery data platform collecting outcomes based on recovery capital for peer work and recovery support services. And of course, we do our advocacy and public policy in Washington, D.C., and more outreach, and we collaborate with partners like Recovery Research Institute on research initiatives. So our association is all over the country and actually international. We have recovery community organizations internationally in United Kingdom, in Africa, and there's a number of organizations modeled after Faces and Voices of Recovery. They are all meet the definition of an RCO, which you'll learn about in a few minutes. But we have Faces and Voices of Recovery Brazil and Canada, and so all of our national or local or statewide RCOs are based across the country, as you can see on the map. But we're going to talk, there's different forms, there's different types, and they all deliver a lot of the same services, but you'll find out more about that in a few minutes. But this was began as part of a grassroots movement back in 1998, when the original Recovery Community Services Program was launched at SAMHSA, when the federal government provided grants for grassroots organizations that were doing recovery support services on the ground, helping to engage people in recovery, people with lived experience of substance use disorders or co-occurring disorders, that engage together to say, to put a face and a voice on recovery, but also to deliver services in an organized fashion. So we became, a cohort of grantees that really kind of set the tone for the future about, engaging people in delivering services and helping people find their pathway of recovery. So there were some really early leaders, you may have heard of them, that were some of those original grantees, but based in Connecticut, and AAAP is based in Dallas, Texas, or Massachusetts Organization for Recovery, and PAR, People Advocating for Recovery in Kentucky. These are just a handful of those early leaders that really were pioneers in recovery support services, and they all operated recovery community organizations. And again, many of these recovery community organizations also operate recovery community centers. So those are two different terms, but the centers are where the services are provided. But as you'll learn today, that's really changed over the past 20 years. It looks different. It's boots on the ground in the community, doing outreach, supporting people and engaging in treatment and finding the services that they need. And we're seeing the emergence of mobile, units providing peer support in the community, especially with, rural communities or places where there's limited transportation. So RCOs have really taken, flourished over the past 20 years. And so we're going to tell you more about that. And I'll turn it over to Phil to talk about what is an RCO.
Perfect. Thanks, Patty. And so, yeah, what is an RCO? Well, as the slide says here, Recovery Community Organization is an independent nonprofit organization led and governed by representatives of local communities of recovery. So what does that mean? We place a value on lived experience. And I think the roots of this movement came from people in communities saying, hey, our needs aren't being met. And we want to, we have lived experience, we've found recovery, and we have lived experience in recovery, and we think that there's value in that, and we'd like to share that with the community. So that's precisely where the origins of the RCOs started. Now, RCOs are fairly easy to identify because they're marked by three pretty easy to identify activities. Activity one is policy and advocacy work. So typically an RCO will engage in one of these three things. So policy and advocacy work, direct peer recovery support services, or recovery-focused community education. A lot of RCOs do all three of those things. Some only do one. But like Patty mentioned, there are centers where people can come and receive services. And all of these things are kind of taking place under the roofs of recovery community centers. I think the key takeaway here with a recovery community organization is that it happens in a community. Treatment is a wonderful thing. It is absolutely critical to the continuum of care, but sometimes treatment happens away from the community where the person with a substance use disorder lives. Recovery community organizations happen in the community, and a lot of times people can go walk down the street or go in their community and get these services. Next slide, please. Some of the kind of the core principles of an RCO, the three that we're going to talk about here, recovery vision. And recovery vision is that the leaders and members of that recovery community organizations have a goal, and that is enhancing the quality and support available to the people that are receiving services of long-term recovery. And there's a SAMHSA definition for recovery, but something that's key to recovery community organizations is this concept of multiple pathways to and of recovery. And what that means is that, sort of most people are familiar with 12-step or mutual aid recovery, or perhaps something like faith-based. Multiple pathways means that the individual finds their pathway toward recovery, and recovery can be something that includes mutual aid or faith-based, but it could be something different. So RCOs are typically wed to people finding a pathway to recovery and wellness. Authenticity of voice means that these are people with lived experience in recovery, and that includes family members, and it includes people that have some experience with the recovery process. And ultimately, these organizations are accountable to the recovery community. And that is something that is also, I don't want to use the word sacrosanct, but it's something that's really important to these organizations. And part of that comes from the history of perhaps pathways to recovery that weren't as wed to people with lived experience, and maybe people that didn't have experience in recovery giving guidance toward individuals that were seeking recovery. So to that end, over the years, we've developed some best practices, which is on the next slide. Thank you. And the best practices, these are sort of through trial and error, blood, sweat, and tears, lots of observation of recovery community organizations. We've come up with what we have identified as best practices. And I won't read the list to you, but I think some of the things that we'll point out, you'll notice that number one is nonprofit. There's nothing wrong with profit. I'm a capitalist. Profit's good. However, we found that for recovery community organizations, nonprofit is a key structure. Also, grassroots. This needs to come from the ground up. For whatever reason, it doesn't seem to work to sort of build it from the top down. Obviously, diverse, equitable, and inclusive policies, practices, and services are key to representing the full community. And we think that peer recovery support services are an important component, although there are plenty of organizations that focus more on policy advocacy. So those are the 10 best practices that we've identified. I think something else, when I mentioned the policy advocacy, community ed, and peer services, those are the central components of an RCO. But over the past 20 years, what we've seen is that there are plenty of other things that recovery community organizations are doing in the community. And like any movement, it's important to be flexible and kind of understand that the need has grown and services have grown as well. And I'll hand it back to Patty.
Thanks, Phil. So there are various types of RCOs, as we mentioned. They could, whether or not they have a physical location is largely influenced by the community needs. So they do a community needs assessment. They engage the community in defining what their needs are. But it also may depend on what the type of organization they are, their mission, the funding that they receive, and their capacity to operate a physical community center. There are the different types of RCOs. There could be a regional RCO serving multiple counties in a region of a state. The local RCOs may serve just a city or the urban area. And then there's small town and rural states that they serve just their small towns. There's also statewide and national RCOs that are providing, services throughout the country, or advocacy or public policy work. The national RCOs may have multiple sites or multiple locations or outposts. And there's some states that are now doing sites, outreach sites throughout the state. For example, in the state of Utah, there's one central RCO, but they have centers throughout the state. The statewide RCOs are often the ones that are doing more public policy and advocacy work. They're helping to do training and supporting the development of other RCOs within the state. So let's talk about what they do. There's the core functions Phil talked about, but there's our core principles. But now let's look at the services that they provide. So in terms of they build capacity, like I mentioned, they're building the capacity of the local community or other recovery support providers like recovery high schools or collegiate recovery programs or recovery housing. They're helping to build that capacity in their communities. Ultimately, the goal is to have recovery ready communities. And so that there's a variety of things that might pop up. You'll see recovery cafes or recovery ministries. And there's also recovery friendly employers and workforce programs. So they're working in their communities to build that capacity. Many RCOs are also, I'd say, majority of the RCOs that we know are also providing peer recovery support services. And they do that by starting with a needs assessment to find out what the community needs, where are the gaps, and not duplicate what's happening elsewhere, but rather collaborate and partner to build those services. They're also doing the advocacy, such as, held legislative days at the state capitol. And they also provide education. So like I said, I mentioned they may do peer support specialist training or recovery coach training to build that workforce. But they also may be doing education for their participants, such as how to get your GED, how to get your driver's license, job skills, and other types of services. They're conducting outreach. They might have booths at a community festival or an outreach fair somewhere. to engage people and get to know that there are people in recovery that are in this workforce that are giving back. And that helps to eliminate the stigma. That's one of the many strategies. They conduct stigma event, reduction events by holding these like a national recovery celebrations and celebrating the fact that we can and do recover, and that there are over 23 million Americans in recovery in the United States, and many more beyond our borders. So there are, these are just some of the examples of the types of services that are provided by RCOs. They'll do recovery coaching, which could be, that's just one way of talking about peer recovery support. There's other terms that are used, like peer recovery support specialist, recovery specialist, recovery navigators. But essentially what they're doing is doing recovery planning, helping that person identify what their needs are. And generally they use a recovery capital scale. They do an assessment of what their needs are, where they need assistance, and then help them move towards in that direction, all driven by the person in recovery. They choose what they want to work on, and that coach or that peer helps them along that path. These recovery RCOs are also providing a variety of support groups. Like Phil mentioned, one of the high values is multiple pathways of recovery. So it could be a smart recovery group, or Wellbriety, or a physical fitness group, or more holistic types of support groups. We're seeing a lot of emergence of holistic approaches. They're doing training such as life skills, helping the person find a job. They're also very much engaging the family. So family support groups, as well as now we're seeing certified family peer support specialists. So they're trained in providing support for family members. And I always want to mention it, not to forget that the youngest of us that are impacted by substance use disorders and the services that are so greatly needed for children that are living in households with substance use disorders. So recovery community organizations are part of that solution and helping to look at the entire age spectrum and the whole family. Many of the RCOs are doing, distributing naloxone and teaching people about overdose prevention. They're helping people connect with housing, and many now are operating peer warm lines. So that's been, especially the past couple of years during COVID, that's been a huge boost to be able to reach people where they are and have them reach out through phone and texting and support lines. This is just a list of the types of partnerships that we see. A lot of them are engaging in contractual relationships, creating a memorandum of understanding, and creating partnerships with emergency departments or healthcare facilities, treatment agencies, treatment courts, and other settings. So that's just an overview of what types of services are provided and how they're doing it. So I'll turn it over to Phil for talking about the impact of RCOs.
Thanks, Patty. And you can go to the next slide, please. And prior to this call, we were having a conversation with Dr. Kelly, and I mentioned that I lived in a recovery capital rich environment. And since you guys are on a call with Dr. Kelly, I'd like to do a quick show of hands, although I can't see everyone. Most people's cameras are off, which is fine. But I'm curious, where are we with the concept of recovery capital? I'm assuming if you're on a call with Dr. Kelly, every single person here knows what recovery capital is, right? This means yes, hands up. Yes, recovery capital. Good. Dr. Kelly's smiling. His smile's getting bigger and bigger and bigger. Okay, good. So obviously the services that recovery supports offered in a recovery community organization provide, they cultivate recovery capital. And the conversation we were having was I was talking about the my kids in school, and I live in Rochester, Minnesota, and we're fairly, I don't know if recovery woke is a term, but there's a lot of discussion about substance use disorder and recovery here in town, and there are a lot of resources available. I think it is a fairly recovery literate town, but there are 2 RCOs here in this town of 120,000 people, so there's pretty good discussion about it, and obviously those organizations support community education and discussion of that. And I think I don't know that is I don't know if that's a rarity, but that is certainly something that doesn't occur in every city in America. Next slide, please. So one of the things that we've done at Faces and Voices is we've tried to look at ways to sort of support and get the word out around recovery supports and the things that people with lived experience can do. So we participated in a project with ASAM and Community Catalyst called Peers Speak Out. And this was a collection. We assembled a national peer council, and we did some research around, not formal research, we'll call it community-based research around what are the things that people with lived experience in recovery, what are they looking for in terms of treatment for their SUD and things that they want. And we came up with some actually pretty interesting information. You would think that people with SUD, the thing that they might want most to do is to stop using substances. And that was actually not number one on the list. Number one on the list was staying alive and improving their quality of life, which actually matches pretty well with some of the data that we were seeing out of our recovery data platform, just around people's well-being. But this is some of the impact of people working with other people with lived experience, is that we're able to get at data in perhaps a little bit different way than folks walking into a doctor and saying, hey, this is what I need. This data, though, has gone to inform quite a bit of subsequent research around what it is that people in recovery from substance use disorder want. Some of these things are sort of consistent with previous research, things on increasing self-confidence and self-efficacy, but this is just one of the pieces of work that we've done. Next slide, please. And there's a name on here that I'm hoping many of you know, but we'll get to that in a moment. Our Association of Recovery Community Organizations is now at about 170 members. As Patty mentioned earlier, we've got a couple of international chapters. We're in most of the states. Our ARCO manager will be happy when we're in all 50, but there is a particularly important ARCO member in Massachusetts called MORE, the Massachusetts Organization for Addiction Recovery. I'm hoping that many of you have heard of it. I have another slide on some of the work that, some of the research that was done on them. But there is work being done around the country at both the state level and at the local level by some of these organizations. I've listed a few here, and there's some that are just doing really incredible work. Next slide, please. As I said, MORE was researched by Brandeis, and they have been busy. Like I said, I'm hoping that you know about them, but this particular quote, I'm going to read it because this is pretty powerful. According to Brandeis Opioid Resource Connector, MORE has been instrumental in policy changes to insurance coverage, the criminal justice system, licensed recovery residences, housing, and education for those seeking and in recovery. In addition, MORE has a presence on the governor's opioid advisory task force, as well as multiple state commissions on a wide range of topics, such as recovery coaching and civil commitments. And for me, that's pretty powerful, because when we think about it, this isn't a lobbying arm of a K Street organization. This is a group that started with grassroots work. And I don't know if anyone here knows Marianne. This is just a woman who started and said, "Hey, enough is enough. We need some help in the community." And she's built with help. She's built a statewide organization that is a model for the rest of the country. Next slide, please. There's additional research. There's some really good stuff done by Friends of Recovery New York. In terms of a statewide organization, a statewide recovery community organization being able to get at data and have connection to this population, which I'm sure as clinicians, and I saw that we had some administrators on the line as well, being able to get at the substance use disorder population and get survey data from them is particularly challenging. But for recovery community organizations, we're pretty connected with them. So being able to get at these organizations is sort of I don't know if it's a superpower for us, but it is certainly something that we excel at. Next slide, please. By the way, I'm not reading the content on the slides. These slides are very dense, but they will be made available to you after the presentation. Just one last thing I want to touch on, the Multiple Pathways Conference. In addition to us saying that recovery community organizations are focused on multiple pathways, one of our organizations, CCAR, puts on a conference focused on the concept of multiple pathways, and we celebrate that. One last thing, and if you could, Patty, if you could go 2 slides to Recovery Month. Since 2020, if memory serves correct, we have been the national host for Recovery Month, which happens in September. This is a website, rm.facesandvoicesofrecovery.org. We support the National Recovery Month effort, and I would encourage everyone to go out there and take a look. Recovery Month is a celebration of recovery, and I feel like I've talked enough because I'm seeing some kind of just stares in the audience, so I will hand it back to Patty.
Fantastic. Thank you so much, Phil. So the question is, what can you do as participants here today out there across the country? I believe internationally, there was a question about this, being available in Canada. So, there are ways to engage. You can learn more about the RCO movement, get to know an RCO near you, find out where they are in your state, and see what you can learn about them, because you would likely find that they're a great place to refer people in need of treatment or in treatment or giving back. And maybe they're in long-term recovery. Myself being a woman in long-term recovery means that I haven't used alcohol or other drugs in over 32 years. And I find that staying engaged with what's happening with the recovery community outside my personal recovery program is a great way to give back. Many of the people that work in this field are in recovery themselves. But there are also opportunities for your organizations to collaborate. You can think about ways that you can, partner on initiatives. And it could be anything from, being part of an advisory council, or joining in on a fundraiser, or coming to their annual dinner when they're raising funds for supporting the programs that they deliver. Many of them are very small grassroots organizations, and as they're growing, they're always looking for ways to partner. The other thing, if there's no RCOs in your community, find out how to start one. Give us a call and or reach out to the Opioid Response Network for free training and technical assistance to start to learn how to start an RCO in your community. Again, make a donation, become a member. many of these organizations have ways for you to be recurring members or donors. And you can share it on your Facebook fundraisers. There's things that you could do to support them. You can send people there to become recovery coaches if they're doing training, or to come up if you have an idea for a new pathway of recovery, a new type of support group, and want to bring that to that organization. You can do that as well. Certainly, they depend on volunteers. And we know that time and talent and treasures is so important to keep the doors open, especially, many of them were hard hit at the beginning of COVID, having to close their actual centers and difficult to provide services. They really stepped up and did amazing work to connect with those that normally would be coming into their centers by doing outreach and connecting with them on the phone. I always believe recovery is before, during, after, and sometimes in lieu of treatment. And so think about them, the recovery community centers, as the 24 hours or 23 other hours of the day, that somebody might be able to reach out for help when they need it, or find some way to engage and spend their time. That's what the value is of them in the community. So educating policymakers, now that you've been here, you've learned about this, what RCOs are, you can talk with, the key decision makers in your state, whether it's about how to spend opioid settlement dollars, or zoning issues in the community, the NIMBY that we face, the not in my backyard. That's the way to educate the policymakers that these centers and the recovery support programs like recovery housing are all needed in order to really create a recovery ready community. And, ultimately, I hope we look back in, 10 or 20 years and say we have a recovery ready nation. So that's our goal and that's our vision. And we're happy that we're here. We're happy to open it up now for questions. So I will turn it back over to Dr. Kelly.
Oh, fantastic. Excellent. Thank you so much, Patty and Phil. We just couldn't have anybody better than Patty and Phil here talking to us about these recovery community organizations, which are really the role model for other initiatives around the world. And thank you so much for that really nice overview. We will make the slides available. Of course, this recording will be available for archive viewing later, along with our other webinars. So avail yourself of that, pass it on in the future. So we're open for questions, comments, discussion.
Actually, Dr. Kelly, I have a question.
Mm-hmm. Yeah.
And it's an open question to the room, and that is, I'm curious if they're in the various clinical practices, if anyone has ever heard of or thought of referring folks out to recovery community organizations or to RCCs. I'll take any answers.
Great question. Yeah, I thought you were going to ask yourself a tough question there, Phil.
Nope.
But you're pitching it to the room. No, I like it. Yeah. Susan, you said yes. I see that Susan Wydra.
Yeah, I have. Yeah. I work now for Head Start training and technical assistance, but I was in a program in New Hampshire as a manager for early Head Start program. And many of the families that we worked with had substance use, and we partnered with our local program called SOS in our community, which is a recovery community organization. So we referred several families there. We partnered with them. We did trainings with them. Many of the home visitors that I manage also became recovery support workers because the number of the families that we were working with substance use. And so, yes, they're very important in our community. They do a lot of outreach and support and education in New Hampshire here in the Seacoast area. So I have had a wonderful experience working with SOS.
Well, thank you for saying that. My follow-up question was going to be, let me guess, it was a dismal failure and no one was helped, but I'm glad to hear that it was wonderful and people, there was help there. So that's
yes,
good.
no, very, very helpful in our community. And you know, we've been particularly hit in New Hampshire with the opioid crisis. And so SOS and many of the other programs, the hospitals, programs working with children and families have all come together and partnered with each other to support our community.
Awesome.
Thank you, Susan.
You're welcome.
Juanita, you had your hand up?
Yes. Phil, could you say the question again? I didn't quite clear understand what you were asking.
I was just asking if anyone had worked with RCOs or RCCs in their community for referrals or help with people with SUDs.
Okay, so we are RCC, and we've been a member of Faces and Voices since 2018. A great organization. We're really, really happy to be part of the organization. We refer out. We have several community partners from the welfare system to the court system to the mayor and the JEGS executive. So we refer out a lot, but we get a lot of referrals from all of our partners. So it's been a great, we're the hub, and it's been great for our community.
Awesome.
Thank you, Juanita. Thanks so much. Erin Henley had your hand up.
Yeah, I'm not Erin Henley. I kind of jumped in on her invite. I'm Russ Reed and from the Kentucky Harm Reduction Coalition in Louisville. Hi, Patty. Good to see you again. We are really blessed in Kentucky with agencies like PAR and our Kentucky Harm Reduction Coalition, and we also have a local ROC, Louisville Recovery Community Center, which is doing quite well. But the comment that I would make here is I've signed on and I believe in many paths to recovery. What I'm having a problem with as I run a long-term recovery facility is that people don't know and don't look at the entire continuum of care. We see a lot of people that know that this is they may think this is an acute disease, but it's really, it's very chronic. They know about treatment, they know about detox, but what they don't know about is that this is a long-term deal. And then once you get out of treatment, it is really a good idea to go into some kind of a long-term residential care, or have a long-term residential support group if you can. And I don't think enough of our policymakers know that, because a lot of the money's going to treatment, initial treatment, and there's not 1 cent going to long-term residential care. So I think we can all do a better job, and hopefully I can do that too, is to convince our policymakers that this is a long-term disease, and it's going to take long-term treatment for that disease too. Thanks.
Awesome. Thanks, Russ. Other thoughts, comments, questions for Phil and Patty? I guess I have just a comment while we're waiting for people's questions or other comments. is one of the things that I notice is just the kind of, disconnect between our clinical services, and maybe this is what was behind the question, Phil, kind of the disconnect between our clinical services and these community-based services, is how we can, I think we need to, and of course, this is one of the reasons why we're here today, is to educate and spread the word about these services, because some of these are fairly new, of course, in the last, well, I'd say fairly new, last 10 years, 10 to 15 years. So they're fairly new, and they're not typically in the training curricula of nurses and physicians and social workers yet. They are starting to be. People are starting to understand and know about them. But I think there's still a big disconnect from what I see, and I work in a kind of a big clinical environment, and even in my own environment where we are trying to spread the word. There's still a kind of a lack of knowledge and understanding about the nature and scope and impact of these recovery support services. So I'm just wondering, Phil and Patty, how we can kind of better do that, better educate our clinical workforce. Have you made inroads there, or things that we can all do to help with that?
Well, I can say some of that is definitely on us, in that, and I can use I can use some of my own personal experience here in Minnesota. What we did in order to get access to referral services out of the Mayo Clinic emergency room system was that we went to the Mayo Medical School and offered information and education around recovery support services directly to the medical school, and they disseminated that information out to students, to the third-year residents coming out. So that was marginally helpful, and then that allowed us to go to the emergency room staff and give them that. But that's a state-by-state, case-by-case, institution-by-institution basis. That's difficult to scale. We also went to the Board of Behavioral Health in the state of Minnesota and offered that with less success than going directly to the individual institution. So on the small scale, there was limited success there, but I think it has to be there. I don't know that there is a national solution, although that is my take. I will defer to Patty.
No, I think nationally through the federal government, I know the Office of National Drug Control Policy at the White House really did an excellent job in this year's drug control strategy to describe each of these types of recovery support services. So you're going to see more coming, more language coming into like state funding. You're going to see more language in like opioid settlement funding that says, there's advocacy going on to say we need to fund and provide recovery support services. So I think you'll be seeing more of that, but it's not an easy solution. I think like we were recently invited to a state pharmacist conference, so that's progress. I mean, for them to contact us and say we'd love for you guys to come and talk about recovery. Those things are changing, it's shifting, but it's not easy. And we need all of you to go back to the councils and coalitions and committees that you're on and say, did you know that there's all this recovery support services going on around the country? And we really need to figure out how to do an assessment in our own community, in our state, and advocate for that to happen here.
Fantastic. Thanks, Patty. Thanks, Phil. Marissa? Am I pronouncing your name correctly? Marisa or Marissa Barbieri?
Yes, thank you. Hi.
Yeah.
Thank
Hi.
you so much. Nice to meet everybody today.
Yeah.
I popped on here because I found you on Twitter, and we were just about to tweet out. We saw you guys were live, so we came on. I'm the founder of PureRx, and we're an app that communities use to find peer support, and we've been at it for 3 years. And I don't want this to be an advertisement whatsoever. I want to just actually support everything that you guys have been doing and saying about this idea of not knowing what services are. I don't think people out there understand peer services. I think within, the community, the professional communities, maybe within the BH communities. But we find emergency room physicians, as we're implementing the app, really take to peer services the idea, but they make a mistake. They think it's patient advocacy, peer services. There's what we're funding now, research to best script out the question to the patients for these emergency room docs and these sites that use this app, to understand better what to ask, how to ask it, so that the patients know what wonderful services are out there and how to get connected and et cetera. So we're working on it here, but I have to say, we're learning a lot as we go on. We developed this app in memory of a kid who died of an overdose. So I have to thank everybody who's in this field working this hard for everyone.
Thank you for that comment, Marisa. Glad you're here. Glad you made it.
Glad we found you.
Yeah. Thank you. Keep coming. Look out for the series. We'll be getting back again in September. Just to follow up on Patty's last point, Dr. Gupta is actually, who's the head of ONDCP, is holding a roundtable, I believe, tomorrow afternoon. You may be going, actually, Patty and Phil, on peer recovery support services to get more information from the community writ large nationally on these recovery support services. So he's looking for information from us all for that. So that's good news that he's, obviously really looking to amplify and underscore the utility of these services for the benefit, for the public health clinical benefit. So now, just before we end, I just want to highlight one thing before we thank Patty and Phil once again. Just going to share my screen real quick. And that is just to let you know, Marisa and others, that we're continuing the series in the fall. We are taking a break over July and August. And as you can see, we've got an exciting up and coming set of science, recovery science webinars. Andy Finch on recovery high schools on end of September. And then in November, collegiate recovery programs via Noel Vest. And then Keith Humphreys, who you may know has been a policy advisor at the White House. He'll be speaking in December on addiction recovery and related policies. We're excited about all of that. And I just want to say thank you all for coming again. For those of you who are new, welcome, keep coming. And a big, big thank you to Phil and Patty for their time and for really helping educate us about the nature and scope of RCOs. And I hope we're all moved up the scale there from a 5 up to an 8 or 9 or a 10 in terms of our knowledge. So thank you both. Don't forget, these are archived, video archived. So spread the word, send the link, review this again and others. And thank you all so much for coming. We'll look forward to seeing you in the fall. Appreciate you. Bye-bye.
Thank you all. Bye.